Good morning, I'm Vic Senese, and this is UroNurse News. Today we're tracking the resurgence of bird flu across the United States, a growing concern about whether we're truly ready to handle another outbreak. According to new data from the USDA, influenza has been detected in 62 commercial and backyard flocks across 17 states just this past month. That's an estimated 6.6 million birds affected, and the virus isn't stopping there. The virus has now been found in dairy cows, cats, and other mammals, raising real fears that it could eventually jump more easily between birds and us. Virologist Angela Rasmussen from the University of Saskatchewan warns that it's happening pretty fast and doesn't seem to be slowing down. She says she's unclear about what the U.S. approach is going to be. That uncertainty has many public health experts on edge. The timing couldn't be worse. The ongoing government shutdown has hampered federal response efforts, with staff cuts at both the CDC and USDA, and even the suspension of weekly animal health lab meetings. Dr. Keith Poulsen, director of the Wisconsin Veterinary Diagnostic Laboratory, says, at USDA, the cupboard is pretty bare when it comes to human resources. He also pointed out that funding is stalled because the Farm Bill hasn't passed, leaving critical programs unfunded. Meanwhile, the CDC flu team remains operational and can still sequence samples from humans suspected of infection. But communication breakdowns inside the agency have raised alarms about transparency and timely data sharing. Between the lines, this crisis has become an early test of the pandemic readiness under our current administration. Animal vaccination rates have lagged, and funding for a bird flu mRNA vaccine in humans has been recently pulled. Even regular expert meetings once held under the previous administration have stopped. Dr. Poulsen put it, we don't have enough good information to make evidence-based decisions, and we don't want to be shooting from the hip when it comes to pathogens like this. In response, the Health and Human Service Department says Secretary Robert F. Kennedy Jr. is reforming the CDC to restore its original mission, protecting Americans from infectious disease. Bottom line, while bird flu isn't yet considered a threat to most Americans, our ability to respond effectively is being tested. Shrinking resources, poor communication, loss of coordination could leave the nation vulnerable just when vigilance is needed most. Tomorrow, on UroNurse News, we're taking you inside the future of medicine. Johnson & Johnson is using artificial intelligence in some incredible ways, from robotic surgery to precision diagnostics to faster drug discovery and safer patient care. We'll break down 6 powerful ways, that's 6, AI is transforming healthcare, innovations that could change how nurses, clinicians, and patients experience medicine forever. Don't miss it tomorrow on UroNurse News. For UroNurse News, I'm Vic Senese. If you found this information, if this update informative, subscribe and like. Always forget they're on this side. And stay tuned for more tomorrow. Thanks for watching. Stay safe, informed, and healthy.
UroNurse News, we've got the scoop, helping you stay